So, hello and welcome everyone to another episode of the Menopause Symposium. My name is Basil Wattar. I'm a associate professor of reproductive medicine and a menopause specialist in London. I'm joined by my friend and colleague Vikram Talaulikar, who is a menopause specialist from North London. And today it's our mutual great pleasure to have Diane Danzebrink, who is the founder of Menopause Support and a long-term menopause advocate on the symposium. Thank you very, very much, Diane, for joining us today. And maybe you can tell us in brief words about you, your background, and the menopause support as an introduction.
Thank you very much to both of you. As Basil said, I'm Diane Danzebrink. I'm the founder of Menopause Support. We're a community interest company supporting women, providing information, guidance and support, lots and lots of free resources. And we also run the Make Menopause Matter campaign. My background is in therapy. I have nurse training in menopause. I'm the author of a book called Making Menopause Matter. And the podcast that is based on that book comes out very soon.
Oh, fantastic. Exciting. We're definitely looking forward to it. So, Diane, today Vikram has picked a very interesting article about the impact of early menopause and aging. And we thought it'll be a very good occasion to have you on board and have your comments on it, as well as how can patients in such, condition access the help and support that your organization offer. So I'm going to start sharing the slides. And Vikram, I think the topic of aging and menopause is definitely of great interest and unfortunately is often not very well covered in clinical practice. So this paper today is looked into the impact of early menopause hysterectomy on biological aging by Kim et al. Can you perhaps set the scene with the clinical implication of this topic, particularly early menopause and hysterectomy?
Thank you, Basil. So I'll keep it short. I think when we talk about premature menopause, early menopause, hysterectomy, often we talk about how do we manage it, the lifestyle, the non-hormonal, the hormonal support. But again, it's always good to see some very good basic research being done. What actually happens when somebody goes through premature menopause or early menopause, especially surgical menopause, because people talk about hysterectomy, people talk about removing ovaries, the various indications. Very little basic research is focused on what are the changes happening from that point on once you remove your uterus, once you remove the ovaries, the biochemical changes, the genetic changes, the epigenetic changes, the DNA methylation, the lipid profile, the bone densities, and whatnot, including the cognitive metabolic effects. So it's good to go back, start from what are the research parameters which are changing when a surgical menopause happens, especially in early menopause settings. That's really the background to this study. And hopefully we'll go along and see what the results were and what the clinical implications are as we go.
Indeed, thank you very much. I think this paper will have an interesting role in counseling women when considering a hysterectomy in this context. So Kim et al. Basically used a retrospective database of a cohort in Michigan that is funded by the NIH in the USA, and this is basically the health retirement study, which a representative longitudinal study. It has more than 20,000 Americans, and they particularly focused on those women who were identified as having menopause early on, and they defined it before the age of 44. And they tried to stratify and look into the differences on epigenetic aging, if they had hysterectomy or not. The cohort itself is fairly well established, and they do very good effort in terms of minimizing selection bias, which is often a major concern when looking into longitudinal data. And they used very interesting methodology in terms of how they measured epigenetic aging. So they collect regular venous blood samples from all these participants. In this context, it was around 4,000 participants. And they used that to look for DNA methylation, which sort of it's a very smart way of telling you how old is your body versus your actual age. And so it took me some time to familiarize myself with this epigenetic research, as I'm an applied clinical researcher. A very, very interesting concept. And I encourage all our viewers to read the article in full, which we can't cover all the basis of the genetic analysis here. And then they did a regression analysis into the expanded biological age while adjusting for key confounding factors such as the ethnicity, smoking status, and other very important confounders. And so in this database, as we mentioned, they had around 4,000 participants, and they found they had about 1,660 venous blood samples to help them with the analysis of the epigenetic aging. And now, interestingly, 30% were identified as early menopause, and out of these 30%, actually had a hysterectomy. What do you think, Vikram? Is that similar to what we would see in clinical practice in terms of prevalence?
No, so I think in this particular data set, the figures appear higher because we generally say about 10% of our women have early menopause. But I think the authors explain in the study, as you rightly said, is that the kind of categorization was anybody having a hysterectomy was often before the age of 45 was labeled as early menopause. And therefore, they may not have distinguished in terms of actually who had POI, who had early menopause. And the figures may therefore appear much higher as compared to what we see in the background population for women who don't have hysterectomies. So again, I think as you rightly said, read the paper because the authors give the limitations and why their figures may appear slightly different to a general paper.
Exactly, and that's why I mentioned about the selection bias, because often this is apparent in this kind of exercises where only those who are willing might be recruiting themselves into this study, for example. But moving on to the interesting findings. So these two figures basically are showing the difference in the epigenetic factor score and the accelerated extended biological aging. And what we are seeing here is that early menopause, regardless of hysterectomy status, was associated with advanced epigenetic aging. It's a very interesting factor finding. And also early menopause and hysterectomy in combination seem to be really, accelerating biological aging. So it's quite a pronounced sort of impact that often I feel we might not be counseling women when we are saying, go have a hysterectomy for whatever reason. It could be for heavy periods, irregular periods, endometriosis, what have you, that there might be significant long-term implications into your health. Now, then the authors did a sort of adjusted regression analysis, multivariate regression analysis. As we mentioned, they adjusted for age, education, ethnicity, and smoking. But clearly in this context, there are many, many other factors to consider. So such as if does the participant has other comorbidities. So for if someone had type 2 diabetes, their biological aging might be very different to someone who did not. Were they on HRT or not? It's the most common thing to adjust for. So all these very important confounders were not really taken into consideration due to data limitations. So we have to take this within its limitation. But what we're finding is that there is a strong association between hysterectomy as a factor to accelerate epigenetic aging, even when it occurs after menopause, which is very, very interesting. And also early menopause without a hysterectomy was also strongly associated with accelerated epigenetic aging. So very important to take these factors into consideration. To me, the most shocking is that hysterectomy might still be contributing to adverse outcome, even if it happened after menopause, which is, an interesting finding. So very interesting paper, I think, and while we acknowledge the limitations of it, I think it's shining a light about a very important concept. Perhaps I can ask you, Diane, to comment, particularly from your perspective as a patient advocate and a charity that helps a lot of patients who might be in this particular health condition.
Yeah, I mean, it is really interesting, Basil, and I think that we certainly over the last decade have counselled an awful lot of women. You know that the survey that we did very recently was actually specifically around surgical menopause, but also those in a premature menopause, in early menopause, those who had had a hysterectomy, and then felt that they were experiencing menopausal symptoms where they had retained their ovaries and were given no information about the fact that actually having a hysterectomy might put them in a position where they might then go on to experience menopause symptoms earlier in their life than perhaps somebody who had retained their womb. So I think what it proves is probably what we all know, which is that we need a lot more research into all of these things. But even without that research, we do know that there are some potential vulnerabilities.
Yeah.
And we really need to be getting that message, not just to patients, but we need to be getting that education to all of our medical health professionals so that they can help those patients at the time in their life when they need that information the most.
I agree. And Vikram, I think from a clinical perspective, what do you propose are potential elements that we can really reduce the impact of this hysterectomy and early menopause on women's long-term health outcomes?
Yeah, so as you said, Basil, I think it's about preparation for surgical menopause, hysterectomy related menopause, especially. I think what you said is really, really important. It's about counseling women when you're planning a hysterectomy, have that discussion with them. This is going to have some lifelong impact on your long-term health. And so initially counseling them, making them prepared for that, accepting that this is going to be the balance of benefit risk. And then if they do proceed with it, putting in place everything, the support after postoperative care, what happens to your bones, bone densities, HRT, non-HRT, weight-bearing exercise, vitamin D, calcium, lifestyle options, metabolic health, making sure you're having your diabetic screening, lipid profile checks, cognitive, looking for any sign symptom, HRT perhaps for early menopause or POI. All those sort of things have to be in place. Women don't have to be unaware of these and then seeking out research on their own and trying to struggle with their GPs or gynecologists to get this. There should be an inbuilt system where you start preoperatively, get the perioperative care you need, and get all these options one after the other with monitoring checks for future. That would be the dream come true if we can get that system in place.
Fully agree. And at least that's what I strive to do with my patients before undergoing a hysterectomy. I think, Diane, I'm aware you guys have done a survey directly from patients, and at the Menopause Symposium, we're very interested to spread the word. So we would love to hear from you about the findings of this survey and how we can help patients further.
Sure, I'll share a few slides, Basil, so that we can go through them. Oh, or not.
Now we can see the slides.
You can.
Yes.
Oh, okay, you can and I can't. So, okay, so what we'll do, if you can see the slides, unfortunately, if you can, there we go. We have them. Marvelous. Okay, so just to give you a little bit of background, this was purely an online survey. So we shared this across social media platforms, and essentially, if this applied to individuals, we asked them to complete it. It was not onerous. There were only about a dozen questions for people to answer, and then they were encouraged to leave us some information about their experience. So we ran the survey in September and October of 2024, and we shared the results of the survey in early December of 2024. So as you can see, the first question there was, had you ever heard of surgical menopause prior to your own surgery? Altogether, we had 521 respondents. And as you can see, 63.9% said no. They had never heard of surgical menopause prior to their surgery. So I think what we've been discussing around having the right information prior to surgery is absolutely key. If you've never heard of something that's going to happen to you, you really need to have it explained to you in whatever detail is right for that individual patient. We also asked, was the reason for having both of your ovaries removed fully explained to you? So we know that there are various reasons why somebody may have ovarian removal. It could be ovarian cancer. It could be that they have very severe endometriosis that has affected sort of affected their entire sort of pelvic area. It could be perhaps that there's somebody who is at a point in their PMDD diagnosis where that might appear to be the right thing to do. As you can see there, 21.7% said that the reason for removing their ovaries was actually not fully explained to them, which is really shocking when you think about the potential implications that there are. Were you made fully aware of the potential effects of having both of your ovaries removed prior to surgery? And a whopping 74.5% said no. They weren't aware of the potential effects. And I think this is the thing that we see the most often, where people they've gone for surgery. It is really shocking when you speak to people who are asked right at the last minute, do you want to keep your ovaries or not? And there's been absolutely no discussion around that. I actually spoke to one woman recently who was asked that question when she was gowned up waiting for her surgery. I mean, that's untenable. That should not be allowed to happen. And of course, we then go on to counsel those women who have had this happen to them at various ages and had no idea of what their ovaries actually did for them. So yeah, it is very worrying. Was HRT, if appropriate for you, because we know it's not necessarily appropriate for all patients depending on their clinical history, was it discussed with you prior to your surgery? And as you can see there, just over 62% said no. They had no discussion about HRT. Many of the patients left hospital without any discussion about HRT. They're commonly told, oh, well, give it a few weeks and go and see your doctor if you need to. But one of the issues that we come up with there is that for a lot of GPs, they are not familiar with the effects of surgical menopause. So consequently, the patient is left to navigate this situation on their own, which again, sort of just simply shouldn't be happening. Were you seen for a follow-up appointment with the surgeon or a member of their team? And that's quite a personal question for me, because my experience of menopause is surgical menopause back in 2012. I had my surgery. I left the hospital within about 36 hours. I was never called for a follow-up appointment. And unfortunately for me, the effect of not having the right information and support prior to or post-surgery was that took me to a mental health crisis. And so I really was horrified to see that people who were responding in 2024 were saying that almost 40% of them never received a follow-up appointment, either with their gynecologist or a member of the team. Is your GP knowledgeable enough about surgical menopause to provide the appropriate care and support? As you can see, the vast majority, just over 83%, said no. And again, this brings us back to education for medical healthcare professionals and information for patients, and just how vital and actually how sensible and how simple that is. It's, yes, surgical menopause can be complex, but giving that education and information can be done in very simple ways if we have the right tools in place. And then one of the things that we hear very often at Menopause Support is people saying, I really feel like I have nowhere to turn because I have no clinical support from the hospital, my GP can't help me, and I can't afford to seek private care. And truthfully, unless it's your first choice, nobody should have to. But we asked the question, have you felt you had no option but to pay privately for care? And as you can see, almost half said, you know, that they had to do that. And of course, they're the people who can, in some way, shape or form, do that. So that might be that they have taken a loan. It might be that they've borrowed money from a friend or family member. It might be that they've put it on their credit card. But there are thousands of people up and down the land who don't have those options. And so consequently, they really feel that they have nowhere to turn. And then if all of those are shocking, this one was really worrying. Where have you found the most information and support for surgical menopause? And the vast majority found that either with an online support group, via social media, or on a menopause website. And that's just a travesty, because we all know that whilst there are some really good resources out there, there's also a lot of misinformation. And so consequently, yet again, women are having to try and find their way through the surgical menopause, or I would say premature menopause or early menopause or medically induced menopause maze, when they're not getting the right information and support. And so when I came to reading through the survey results, I then noticed that over 300 respondents had taken the time to share their personal stories. And I read all of them. There's around 350. And it just made me cry, because it was heartbreaking to read how many people are left to struggle on their own and feel that they have nowhere to turn, when we could so simply be educating our healthcare professionals and informing our patients prior to, whether it's surgery, whether it's as a result of a diagnosis of premature menopause, maybe because of POI, of early menopause, or perhaps somebody is being medically induced into menopause. There are very simple things we could do, but it seems that we haven't yet done them, which in 2025 is tragic. And just in case there are women, or perhaps their partners, friends, family, who are out there and you've seen this and you're thinking, yeah, I'm struggling, I need to know where to turn. People are very welcome to get in touch with us. The website is there, menopausesupport.co.uk. I have quite an unusual surname, so it's not difficult to find me on social media. And thank you both for inviting me to share the details of this important survey.
Thank you very much for sharing this, Diane. I think it's very strong findings, and sort of to me, it's not shocking. It's a reflection of our current health system, unfortunately, because as a surgeon, I'm finding myself more and more operating on people who I did not see in clinic, just because there's pooled theater operating list nowadays, and the system does not allow us to offer follow-up consultations as well. So it leaves you offering very limited care to patients who are really in need. And while doctors on the shop floor are always fighting against it, and I think it's a wider systemic sort of issue that we have to address at a higher level. Vikram, any concluding remarks from your side?
Nothing, Basil. I fully share the difficulties and challenges we are facing with follow-up care, or for you as a surgeon, seeing patients before and giving them enough time to digest the information that you're giving them. Just a couple of sentences. Thank you, Diane, for all that you do. You are supporting a huge number of people out there who need support and care. And when we in the healthcare system cannot support people enough, it really boils down to organizations such as yours who are filling in that gap and will continue to do so more and more as we are struggling on the healthcare setting side of things. From our perspective, Basil, I think it's all about healthcare education. So we need to keep reaching out as many nurses, GPs, doctors, gynecologists, surgeons, as well as people who are allied health professionals who will be looking after these women pre or post-op, so that we make as much information available, help people make the right choice, and keep giving them that support that they need. Hopefully, this video will contribute to that. But of course, we'll keep working together in this field, hopefully, so that we can come up with some guidance, some concrete help for people, as well as try and maybe, if possible, get funding for research projects in future which focus in the surgical menopause area.
Definitely, and I really hope to see these results published. I think very strong results and very impactful that will hopefully shape research and practice in the future. I think we're going to wrap up here. Thank you very much both for this very lively and impactful episode, I think. Thank you to all our viewers. Please like and share and subscribe to the channel, and send us your comments and requests for future topics, and see you on the next episode.
Thank you.